I shall be talking to you about ventral hernia. Ventral hernia is otherwise called incisional hernia, and this is seen essentially in women who had a previous operation in the abdomen, and this operation can be in the form of birth control called puerperal sterilization, or it can be due to a cesarean section or abdominal hysterectomy where the uterus is removed, and this can occur due to various reasons. One of them is a weak abdominal wall. After repeated childbirth, the wall may become very weak and form a hernia. And two is when for some reason soon after operation the wound gets infected and the sutures may give away, and that will form a hernia. And again, when there is chronic constipation where one need to strain at stools, these hernias can occur. What is the problem with this hernia? Hernias are one that they look very grotesque, they do not look nice, and sometimes if the abdominal wall is weak, where you call what is called as divarication of the recti, the abdomen look very protuberant, and in many women they look as though they are about 8-9 months pregnant, and that will be bothering them a lot. If the hernia is small, the intestines or the fat from inside the abdomen may go in and come out of the orifice, hernial orifice, and can cause pain and subacute bowel obstruction, and this also will require attention. Quite often these hernias are initially ignored by the women folk, but as they become bigger and become problematic, they come to a surgeon's attention. How do you investigate these patients? The patients are investigated. All these patients with ventral hernia or incisional hernia will require surgical treatment. There is no medical treatment, and using of belts will not be of great help for a long time. Now, before surgery, we investigate for two things. One is for the fitness for surgery, where diabetes, blood pressure, asthma are tested and treated, and two is presence of any other abnormality like stones in the gallbladder or some problem at the ovary, etc. Because once a ventral hernia repair is done, it is very difficult to go and operate inside the abdomen again. Now, how is this operation done? This operation is done in two ways. One is by laparoscopy and two by open method. A number of patients can still be treated laparoscopically as ventral hernia, and these are usually in smaller hernias and when they are getting operated for the first time. If it is a recurrent hernia, the laparoscopy will become slightly difficult. The laparoscopic procedure is where we make holes in the abdomen, go inside the abdomen, have a look at the defect of the abdominal wall, peel out all the fat that is stuck there and also any intestines that gone into the hernia, and then put a mesh. It's called a composite mesh, which has got a smooth side onto the intestines and a hard side onto the abdominal wall, and that is tacked with threads and tackers, namely small minute screws, and that will remain in place. Patients who have divarication, otherwise thin abdominal wall and a very big hernia or a recurrent hernia, etc., is not easy to do laparoscopically, and they would require what is called as open surgery. This open surgery is done where the abdomen is opened and a mesh is inserted in the defective area, and the scar is trimmed and made look little better. And certain other conditions where there is divarication and a huge abdominal wall with obesity and a lot of fat deposited in the abdominal wall with folding, overhanging of the skin, we take up a procedure what is called as abdominoplasty, where we make a cut in the lower abdomen and the scar will go under the panties, it will not be seen. It is a cosmetic procedure, and we raise the abdominal wall and double breast or fold the abdominal wall on itself and put a huge mesh which we anchor to the pubic bone, to the lateral iliac bones and the costal margins to keep the mesh in place. It is a 30 into 30 centimeter mesh, and cut off the excess skin in the abdominal wall. This is what is called as abdominoplasty. If laparoscopic procedure, a patient needs to stay less than 24 hours. For an open surgery, they may stay anything up to 4-5 days, and if it is abdominoplasty, a patient required to stay in the hospital for about a week. Now, these abdominal wall hernias, again, the chances of recurrence are there, and one has to keep that in mind. So, in the immediate post-operative period, one need to use this belt or binder for a month or two and should be little careful with the way they move, the bend and so on. So, in effect, the ventral hernia or the incisional hernia is seen more in women, especially who had an operation in the abdominal wall and who had some sort of a problem subsequently, and when the abdominal wall becomes thin. These ventral hernias require surgical repair either by laparoscopy or open method, and if it is open method, it is just a mesh repair or possibly an abdominoplasty. With that, the lady will get a new life. Thank you.